So similar sort of story to last time. I'll talk a little bit about what's happening with our cases and variants, and then I will talk a little bit about vaccination. And unfortunately, the story I don't think has changed too much in the last week. Last week, I talked about how variant cases were continuing to increase across the province as well as in Niagara. And that's very much the case here still. If we're looking at our daily cases of variants, we have this, fairly noisy pattern, but you can see it's clearly trending upwards, and we're seeing between 400 and 700 cases a day are a variant case. So absolutely not the direction we want to be seeing those cases. Looking at the proportion of our cases that are variants, that is continuing to go up. The Ontario Science Table, you may remember, had predicted by the middle of March, it would be about 40% of the province's cases would be variants. Back on January 20th, when they did the point prevalence study, it was only 4.4%. And then since they've started routinely testing for it in early February, it has continued to go up. They've changed their data reporting slightly, so there's a little bit of a discontinuity here, but you can see it's continuing to go up. And this is a 7-day average showing that it's up to 35%. This is delayed by a few days given the provincial reporting. You can imagine that that is clearly probably got to 40% once you're no longer pulling it down from the average of the previous 7 days and you've extended out to where it is now. So we are definitely seeing that number increasing as predicted, and unfortunately, that's not what any of us wanted to see. I've talked a lot about this graph in previous weeks because I think this is really the core of what we are looking at. We're seeing variants of concern here, and they're predicted they're going to continue to climb. Our non-variant cases may continue to go down, and then we'll see an overall trend where it looks like it's going down for a while, cases will flatten out, and cases will start to increase. And this is from the Ontario Science Table's briefing last Thursday, and they're showing here that our variant cases day to day, absolutely, that is going up. The non-variant cases, just as that other graph was showing, are going down. Softened out a little bit since we started to reopen the province after the shutdown, but still continuing to go down. And then if you look at the net trend, I of course have my graph here where we see what's happening on a provincial basis, where cases were going down, they flattened out, and as very clearly we're seeing an upwards trend. And that really seems to be exactly what the province was saying, the Ontario Science Table was saying, in terms of our non-variant cases might keep going down, but the variant cases would pick up, and the sum total would be that we would start to see this increase. I can actually layer in here what it looks like when we put the non-variant cases on top of this. And you can see, again, the non-variant cases not really increasing, slightly going down, the total going up, and that difference is the variant cases. And over time, you can see each day that is becoming a wider and wider gap there, contributing more and more to that increase. And as this continues to go down, those continue to go up. We're going to continue, unfortunately, seeing that increase as we go forward. Looking at what the Ontario Science Table is predicting, this is what they had seen in terms of cases with it sort of flattening out. And then projecting one of these scenarios could be what transpires, with potentially two very bad scenarios where cases really grow at a very sharp rate, not actually very far along, just in the near future within the province. There's an optimistic scenario here where we are able to, hold the line in that growth. That really, depends on the timing and degree of relaxing of public health measures. And that really is implying that the province needs to take it slower and be much more careful about reopening, or we are likely to end up on one of that orange or the purple trend. Now, this is looking at a province-wide trajectory. The Ontario Science Table did put this graph out showing what's happening across each of the 34 local public health agencies. And what they're showing here is that in 2/3 of them, cases have gone up between February 21st and March 6th. So you can see Thunder Bay with that very, almost doubling of their daily cases, and hence why the emergency brake has been applied there. Other places like Lambton County, etc. Sudbury, again, emergency brake applied there, and you can see the very big increase. Other places are much small increases, including us here in Niagara, where we've only seen, a relatively small daily case increase. But I think that belies that between February 21st and March 6th, we did go through a period where we went from seeing, 20 some cases a day to falling into the high teens. And now we've actually gone back to the high 20s cases per day. And that's unfortunately the impact of us originally reopening into gray and now having reopened into red. There are a few local public health agencies that aren't seeing cases go up. I think it's notable that, Toronto and New York are two of these, which were regions that stayed under a stay-at-home order through March 8th. So we're seeing that they went down because they stayed under that stay-at-home order. I also note that Simcoe, Muskoka, and North Bay, Parry Sound, both regions where the emergency brake was used, North Bay, Parry Sound kept under the complete stay-at-home order for a longer period of time, which is why its cases came down. Simcoe, Muskoka went back into gray with the emergency brake, and its cases came down. So there's some evidence that using that emergency brake in continuing regions in a stay-at-home order has contributed to some regions managing to do better. There's, of course, a few other regions here that aren't in those contexts and fortunately have had a bit more luck. If we zoom in now on what we're seeing in Niagara and looking beyond just March 6th up to closer to what we're seeing as of today, I can do a similar graph to the provincial one, looking at daily cases over time, and you can see we came down to that second wave, we flattened out, and it very much looks like that we're seeing it scooping up, which is what I showed in that previous graph. So obviously our cases are going up. And again, if we layer on here what's happening, if we take the variance out of this, you can actually see we're doing a lot better without the variance, where we maybe even have flattened out, but that gap between where our non-variant cases are and our variant cases are each day does seem to be increasing, and that's therefore, even if we are staying flat with the non-variant cases, is contributing to an overall increase. Obviously, the big concern with that is that, as cases go up, there's a proportion of those people who are going to need hospital care. There's going to be a percentage of them who will need ICU care. And in the province, this is what it looked like in terms of our hospital and ICU beds. Back in, September, when we first went into fall, numbers of people hospitalized or in ICUs for COVID-19 was quite low. That, of course, has gone up substantially over the course of the second wave. As we got the second wave under control, it was coming down, but we never really brought it back down to a low level. We moved ahead as a province to reopening before we had gotten things under control, and that has meant that hospitalizations and ICUs admissions have flattened out. And so if with our growing cases, we start to see more hospitalizations, more people in ICUs, they're already pretty full. There's not a lot of excess capacity there to absorb the impact of that. And that makes it, I think, increasingly likely that the province is unfortunately going to be forced to move into a third lockdown if we're not able to see a sharp change in terms of our case growth very soon. I just want to highlight that the province had set a threshold about 150 ICU bed occupancy as its danger level, and that's about here. So we are still, almost twice as high as what that danger level is, and so we've never really recovered from that. And the Ontario Science Table is taking, their case growth into account and looking at where we could potentially see ICU admissions going. And in every scenario, ICU admissions do go up. In a couple of scenarios, they start to go up very soon as cases increase. And they've actually drawn in here that 150 capacity threshold, which was the warning, which we're already well above and on track to start to see going even higher. So the outlook in terms of cases and the trajectory of our cases is not looking good in Ontario, nor I think is it looking very good in Niagara. I think there's very little time for us to turn this trajectory around and bring cases down to a level where we aren't going to see our hospitals and our ICUs overwhelmed, and where we unfortunately won't start to see Pearsons passing away again from COVID-19. And I think it's really critical that, if the province isn't going to move towards a shutdown, they seem to signal they're not going to, that we all take it upon ourselves to do what we can to stop cases from rising. I really do think we all need to continue to have the mindset that we had back a year ago when we had that first lockdown, where we all had that motivation to stay home, make sure we're preventing infections from rising, helping flatten that curve so that we're able to keep cases under control. And I think, back in last year, it was easier for people to do this because there wasn't a sense that this was going to be a year-long process. There's hope it could be a much shorter process. We were new to it and we had a lot more motivation. And I hope that we can actually look at this situation now and actually draw back that motivation, because I don't think this is going to be a long period of time. I don't think we need to do this on an open-ended basis. I think we just need to do it for maybe a couple of months. And over those couple of months, we'll get to summer and we'll get to a much wider distribution of vaccine. And once that is in place, we can actually relax a lot, and that is going to protect us. But my message really to the people of Niagara is, if we can do anything right now, it's to make sure we do our part to stay home, minimize all our social contacts, try to have that mindset of being a lockdown so we actually have the benefit of not seeing infection spread while not incurring the economic harm of having to shut down businesses to get there. Now, I mentioned vaccines are going to be a key part of how we emerge from this, and I think that's the other part I really want to talk to us about. These are the priority groups the province has outlined for vaccination through phase 1 of vaccines, which is where we're at right now, the next phase, which is phase 2, and then phase 3 onwards. And as you can see, we've actually moved through a lot of these groups in phase 1. The long-term care home, high-risk retirement home workers, we are done with that group. We've finished vaccinating our top priority healthcare workers, as well as some of the other key congregate settings where there are seniors. And we're now in this final group of persons within phase 1, which includes our, some additional healthcare workers, home care recipients, Indigenous adults, and I think most relevant now is the 80+ population, which is the largest group. And work has already been going on with vaccinating these over the past week, and of course, with the launch of the provincial booking system, vaccinating the 80+ is going to really accelerate, with vaccine supply starting to increase over the next couple of weeks. I just want to also flag that we have actually started work on one of the groups within phase 2, particularly the homeless shelters, where we are vaccinating them before the homeless shelters start to scale down as weather warms. We wanted to make sure we had the opportunity to vaccinate this population before it was too late. As well, we are also making sure to get out to some of the other high-risk congregate settings with adults, with seniors, to make sure they are vaccinated as well. So I mentioned, Indigenous adults are part of this vaccination group, and that's one group that you've heard that we've already made a start on. We held 2 clinics last week at the Fort Erie Native Friendship Center and vaccinated over 1,000 members for our Indigenous community, which was excellent. And this was an opportunity for us to put our vaccine clinic plans in place and give them a test run and try to further optimize them before we launch our bigger clinics starting this week. And those clinics were quite successful. We're at the Niagara Region Native Friendship Center in Niagara-on-the-Lake today, doing another round of clinics for that population as well. Last week, we announced our clinics for vaccination for the 80+ population. Of course, we are here today with the provincial portal opening for registration as of this morning. And thus far, I hear it has not crashed, so that's excellent news. We have escaped the predicament that some other provinces felt. We've left a couple of days here of gap before we start holding clinics to make sure that there's an opportunity, if there were any issues with the provincial system, that they get worked out so that by the time we start our clinics on Thursday, we'll be all set to go. I'm actually very pleased to report that as of noon, we did a look at registrations, and our first clinic on Thursday in Niagara Falls is already completely booked up. And we actually have already over 3,600 people having booked into clinics over the 3.5 weeks in which we have clinics. So that's excellent news that our elderly population is getting on the system, they're getting their appointments booked, and we're starting to fill up some of our days of clinics to make sure we're able to vaccinate this group very soon. This clinic that we've scheduled, that we've designed, of course, rotates through our 11 sites. And it's really important that we rotate it through all 11 sites because we know it may be difficult for some of our elderly to travel across Niagara. And so we wanted to make sure that there was at least one local option for everybody wherever they might live so that they have an opportunity to get to a clinic without too much difficulty. We've scheduled the size and number of clinics to match the vaccine supply that we are going to be receiving. So the schedule we have here, when combined with the work that Niagara Health is going to be doing at their clinic, will really use up all the vaccine we receive during this period. And so this clinic was designed to both match the population of 80+ individuals we have in each of our municipalities and offering a clinic matching that population, as well as making sure that we maximize use of vaccine supply, using it as quickly as we received it. And so that is what has informed this schedule. We actually also tend to do multiple days in a row in a location. And the reason for that is that we know from our experience running a clinic that when you go in the first day, just being there and running things live, you learn lessons about things that you can improve just given the physical layout, given the unique features of that clinic. And so we want to be there a few days so we can optimize it and get it to operating at full capacity. So next time when we come back, we know we can start at full capacity. We actually found that last week when we were at the Fort Erie Native Friendship Center. Many small hiccups on that first day, and then the second day we're able to iron that out and actually had a much smoother clinic experience. And so by doing multiple days in a row in many of our locations, we'll be able to optimize these clinics for those later days and make sure we're running at full steam whenever we get around to the next rotation through all of these locations. I just want to finish off by quickly highlighting where we are at already with the vaccination of our 80+ population. So looking at the 2019 estimates of the 80+ population between from using the census and Stats Canada's projection over time, in 2019, basically the 80+ population was just under about 2,800 persons in Niagara. About 20,000 of them are the ones who are a little over that are not in long-term care homes and retirement homes and are the group that's brand new to receiving vaccinations. When we look at this group, we have actually managed to already deliver vaccine to about 8,000 of that group. So that is excellent news already. So 8,000 of this population is already done, leaving us about the 20,000 or so additional residents that we need to vaccinate over these next few weeks. Niagara Health, as you know, has already been reaching out through primary care to acquire names of 80+-year-old persons and book them into their clinics. As well, they are vaccinating the 80+-year-olds within their hospitals who are well enough that they can get vaccine to make sure we pick off that population. And through their efforts, there's actually another 4,000 persons who are already booked up to get their vaccines over the next few days. As well, I mentioned that there's already 3,600 plus people as of noon today who've booked into a public health clinic. And so we're already making very good progress at working through these 28,000 people. In fact, if we look at it by a percentage, we are actually already, 31% of our 80+ population is already vaccinated. Another 15 have booked into Niagara Health. Another 13% have booked into one of our public health clinics. And so we've already actually right there covered off over 50% of our population. We're actually at about 58% of our population has already been vaccinated or booked into a clinic. And hopefully over the next few days, we'll get that balance of 41% booked into one of our clinics so we can make sure they all get vaccinated as well. And so we're making great progress. We're a third of the way already done. We have almost another, 30% already queued up for their vaccinations, and that's just as of noon today. And so hopefully through the rest of today, tomorrow, we'll be able to get everybody else booked up and actually have everybody on their way to getting their vaccine very soon. So very successful, I think, start as of today with registering, and we hope to be able to see a continuation of that success starting Thursday when we start holding clinics. And with that, I'll turn it over to questions.
Thank you, Dr. Hergy. Okay, so first up this week, we have Bonnie. So I'll just give me 1 second here and I will ask you to unmute, Bonnie. You should be good.
Thanks, guys. Thanks for hosting, Meredith, and thank you for the presentation, Dr. Hergy. My first question is, if provincial officials called you today and asked you which color level you think Niagara should be in, which color would you suggest?
I would suggest that we should be at the very least holding pat in the red level. We are seeing cases increase right now. That obviously means the measures that we have in place aren't doing enough to hold the line on that. So we absolutely should not be moving to any level of greater opening than the red level. I would also suggest to the province that they need to look at the Golden Horseshoe as one big unit and think about whether we all need to, as a unit, move to perhaps a higher level of restrictions. We've seen that, what happens in other parts of the GTA leads to cases rising in Niagara. We've also seen that in places like Toronto and Peel, when they have been in lockdown, they have not been able to hold their cases down. Their cases have gone up. The only where their cases go down is if we actually put all of these Southern Ontario into a lockdown state, and that's the only way things decrease. And that's just because I think there's so much interconnectedness across the GTA. And so I'd suggest that Niagara should stay in red at the very least, and there should be provincial examination of whether we need to move the entire Greater Golden Horseshoe into a higher level of restrictions so that we can actually tamp down cases across the interconnected Golden Horseshoe.
Yeah, thank you. My other question is just on the locations of the vaccine clinics. I know the first one opens up on Thursday in the Falls, and they're rotating, I believe, right now.
Correct.
Yeah, so thank you for bringing that up. That's great. So eventually, will they all be operating every day?
I don't think we're going to get to a point where all of the clinics are operating every day. Unfortunately, given the just sheer number of clinics, we're not able to do that. I look at a place like Toronto, which is planning to actually only have at most 9 clinics total, and they're only launching 3 clinics at the end of this month because that's all their capacity is able to manage. And we're, of course, maybe 8 or 9 times smaller than Toronto in terms of our capacity, so we're not going to be able to sustain 11 full clinics. What I do think we will likely move towards is eventually having 2 or 3 clinics running every day. Probably that would include 1 large clinic and then maybe a couple of smaller clinics in other locations. You can already see in the schedule, in the, March 31st, April 1st, April 2nd, we are holding 2 clinics on those days. There's another date here, April 9th, 10th, where we're holding 2 clinics. So we are, branching out into doing 2 clinics. I think that'll become more of the norm later on and eventually 3 clinics, but 2 things are really constraining us from doing that right now. First is the vaccine supply isn't there for us to actually run multiple clinics, plus Niagara Health to run their clinic. We are actually using up all our vaccine, basically running mostly single clinics through this period of time. So we are sticking with that for the time period until we have enough vaccine, as well as we scale up staff when we train staff and get them training and proficiency. That'll enable us actually to start to run clinics perhaps with a smaller staff footprint and allow us to free up staff to run a 2nd and 3rd site on more days.
Okay, thanks, Bonnie. And Ludwig, you are up next. Let me just find you on the list here, and you should be able to unmute now.
Thank you, Meredith. Thank you, Dr. Hergy. Hello, everyone. Hope everyone's well. I missed a little bit of the start of the press conference here. I couldn't get in technically, but if you don't mind, Dr. Hergy, if you could just reiterate to me basically what is the status of the growth of the variants. There seems to be I know that there's a pretty big backlog in terms of cases that have been caught in screening as opposed to the sequencing. So where do we stand with the cases that are variant strains, and when do you think that we're able to sort of discern what variants we're talking about? I see the South African and Brazilian are rising in Europe. And I see we only have 4 confirmed UK cases here. So could you talk a little bit about that and perhaps what to expect over the next few weeks?
Yeah, so I think the first thing I'd highlight is that screening test the province is doing is extraordinarily accurate. I think it is well above 99% accurate for detecting a variant. It's not really giving us false positives. So I think we can basically treat, and I do treat, that if they have detected a variant on screening, we know it's a variant. The only thing we don't know for sure is which one it is. When we look at the provincial data, it's overwhelmingly the B117, the variant that originated in the UK that we're seeing. I'm going by memory here, but I want to say there's been over 1,100 cases of the B117 variant, and there's been a total of maybe 80 to 90 cases of the other 2 variants combined together. So, we are looking at 90 to 95% of our variants are that B117 or possibly even higher than that. And I think we can assume that almost all of the variants that we are seeing are probably the B117. And I'd venture that that is likely the case in Niagara as well. That's really what is dominating. And so really looking at countries like the United Kingdom then, which have large numbers of the UK variant, I think is how the Ontario Science Table is doing its projections of what's going to happen to cases over time, looking at how that variant particularly behaves and grows, and projecting there from there on in. So, my sense here is in Niagara, we're seeing the UK origin B117 variant. It's clearly spreading more quickly than the non-variant of concern cases here. And I think we're going to continue to see that unfortunately grow the way that places like the UK and other countries saw it going forward.
And do you have a follow-up, Ludwig? And again, apologies for leaving you in the waiting room.
No issues at all, Meredith. Thank you for the for getting on that swiftly. Yes, Dr. Hergy, a second question that I noted last night when looking at the vaccination rates for the retirement homes. I noticed that Cobblestone Gardens in Thorold appears to have the largest amount of people who are listed as having refused the vaccine, about 6%. And obviously there's also an outbreak ongoing there. So I'm wondering, is that just a data hiccup because they got it via Niagara Health, or is it in fact that Thorold Cobblestone Gardens residents are refusing the vaccine? So if you could tell me about that, and also what does those numbers mean when you are encountering seniors who are refusing the vaccine? What is happening there?
Yeah. So there are unfortunately always going to be some individuals who opt not to get vaccine, even though that's something that we would strongly encourage that they receive. Just taking a look at the data here for Cobblestone Gardens, I just want to see exactly what we're seeing. There's really two scenarios where someone might not get vaccinated. One is that they've declined to be vaccinated. They've chosen not to get vaccinated. Another is sometimes there could be a medical reason why they wouldn't be vaccinated. And one of those medical reasons could be if, for example, someone is feeling sick, if there actually is an outbreak of COVID-19 and certain individuals aren't feeling well, that could be a reason they don't get vaccinated. Looking at the Cobblestone Gardens, it does appear that it is individuals who have refused as opposed to had a medical reason not to get vaccinated. I unfortunately don't have any detail on exactly what that reason was. We have seen in some of our other homes where on an initial visit, people have declined vaccination and then have agreed on a subsequent visit. Maybe once they've seen more of their colleagues get the vaccine and seen that it has gone well for them, they maybe have a bit more confidence, but I don't have any information specifically on those 6% or so who opted not to get the vaccine.
Okay, thank you, Ludwig. Richard Hutton, over to you. I will unmute you.
Thanks, Meredith. Thanks, Dr. Hirji. Dr. Hirji, you mentioned with the clinics that went on in Fort Erie, with the Fort Erie Native Friendship Center, on the first day there were some hiccups. Can you kind of elaborate a little bit on what those were and what was done to kind of fix them?
Yeah, so some of the kinds of hiccups that we saw is we've never run a vaccination clinic where people are wearing face masks and face shields. We realized that actually does hamper our ability to talk to people over the long distances that we're trying to have. So we had to make some adjustments of how we do that. We did notice that there was some confusion by people who are going through our clinic with some of these signage and arrows and wayfinding that we had. So we made some corrections to that to make it a bit more obvious and clear for people how they would work their way through the clinic. Those really, really nitty-gritty operational things that once you actually have people from out in the public come into your clinic, you actually start to see how things operate. And those are some of the examples of what we were able to improve upon the second day.
Okay. And the other question I had was, you mentioned like with the doctors doing vaccines through Niagara Health. Is there coordination going on between Niagara Region Public Health and Niagara Health to make sure people don't get confused about where they should go?
Yeah, there's absolutely coordination between us. Really, since December, we have had a joint task force working on this where we pretty much actually have people meeting almost every morning to talk about what's happening on each of our sides and making sure we're coordinated, and especially coordinating in terms of the vaccine to make sure we both know what each other's plans are in terms of what vaccine we're going to use. So we make sure we don't use it up prematurely, make sure each of us can plan for what's going to happen. So, absolutely, we are in constant communication around those issues to make sure we're coordinated.
Thanks, Richard. Next up, we have Stephen from Cogeco.
Okay, thanks, guys. Hope everybody's doing well. Dr. Hergy, it goes without saying that many people are suffering from COVID fatigue, and you're saying that the vaccine is going to play an important part with us, I guess, weathering the storm. And with the nicer weather coming, when do you believe everyone in Niagara will be vaccinated by?
That's a difficult question to answer. First off, I think there's a couple caveats to make here. We don't have a vaccine that's licensed for anybody under 16 years of age. So we're not going to be able to vaccinate people, children in Niagara. The other part is we know there's going to be some individuals who refuse vaccine, and there's going to be a small group of people who actually absolutely refuse and never get vaccinated. So I don't think it's a realistic expectation that we'll ever have everybody vaccinated. What we're really looking forward to is the vast proportion of people 16 years of age and above getting vaccinated, at least everybody 16 years of age and above having the opportunity to get vaccinated, and then hopefully not too many of those decline. It's all going to depend on how quickly vaccine supply arrives here. Vaccine supply has really been the limiting factor around the world in how quickly vaccinations are done. We all know Israel is, roaring ahead of other countries in terms of vaccine, and they made a special deal with Pfizer so that they got early access to Pfizer vaccine, and so they have actually been able to move ahead more quickly than other countries. United Arab Emirates, I think, is second on the list, and I think they paid a big premium to get vaccine early, so they have again got early access to vaccine, and so their vaccine program is ahead of other countries. In Canada, unfortunately, as we've seen, we have not been a country that has received more vaccine up front, and that has meant that our pace of vaccination has been slower. When we've got vaccine in Niagara, we've basically administered it within a week of actually receiving the vaccine. It doesn't sit around for very long. It gets into arms very quickly, but we are limited by the amount of vaccine that we're getting. So it's all going to depend on how quickly that vaccine comes to how quickly we can move forward. Now that we do have 4 different vaccine products available, the province and General Hillier specifically have mentioned that he hopes that perhaps by Canada Day, we could have at least 1 dose be made available to every person in Ontario. So that would, give everybody the opportunity to get at least 1 dose of vaccine by the middle of summer, and presumably be another 4 months or so before we actually had the opportunity then to go out and give a second dose to everybody. So those would be the rough timelines I could share based on what the province is saying. But again, if vaccine supply slows down, we're not going to meet those timelines. If we somehow get more vaccine, we could potentially actually get to those timelines even more quickly.
Thank you for that.
Follow-up, Steve?
No, not right now, but thank you, Dr. Hergy.
Okay, up next we have Don Mitchell, and you should be able to unmute.
Thank you very much, Dr. Hergy, for taking my question. Simple question, back to vaccines, as you were talking about. I wonder if you can talk about the 4 that have actually been approved and how they relate to Niagara in terms of what you're actually going to be getting. Obviously, Pfizer is coming in, but AstraZeneca, what are the other, what are the 4 vaccines like? How are they in terms of getting to Niagara? How is their status?
Yes, so Pfizer-BioNTech vaccine has been the one that we have pretty much exclusively had access to here in Niagara. It's been the cornerstone of our vaccination program. We are going to see a ramp up of receiving doses of that vaccine according to the province starting really next week. So that's excellent news. Challenge with this vaccine is, of course, it needs to be kept at an ultra low temperature. There are complexities around actually managing and moving the vaccine as well as prepping it for use. And so it's going to be a vaccine that probably will remain the one that public health and Niagara Health use, because we have the freezers as well as the technical know-how to manage those vaccines. And so those will probably be the key vaccines we move forward to using. The AstraZeneca vaccine is a vaccine that doesn't need that kind of freezer to be stored in. It's a vaccine that can be stored in a normal vaccine fridge. And so this is a vaccine the province seems to be targeting towards pharmacies as well as primary care. They've announced 3 sites where there's a pharmacy pilot, and I think 6 sites where there's a primary care pilot, where primary care and pharmacies are getting the AstraZeneca vaccine directly and able to administer that vaccine. I am hoping that that pilot will very soon expand to other parts of the province, including us in Niagara. So as more AstraZeneca vaccine comes into the province, maybe in early April, we will now see our Niagara primary care and Niagara pharmacies also delivering the AstraZeneca vaccine. The final vaccine that's been approved is the Janssen vaccine, which is a Johnson & Johnson subsidiary. As I understand, that vaccine is not going to be made available to Canada until April. So we don't really know where it's going to go yet. It's again a vaccine that can be stored in a normal vaccine fridge. So it could be another option for primary care and pharmacies to have on hand for. I think it would be nice for us in Niagara to actually have some access to it in public health as well. When we are vaccinating, for example, a homeless population, or if we are vaccinating people in a detention center, where we don't have the guarantee that 3-4 weeks, let alone 4 months later, we will be able to find that person to give them a second dose. Having a 1-dose vaccine like that could be really useful. So we're hoping that it'll also be made available to public health for some of those populations. We also see it as perhaps a good vaccine for when we want to go vaccinate elderly people who are really homebound. The AstraZeneca vaccine isn't recommended for those above 65 years of age and older. Pfizer and Moderna aren't really easily moved, so they can't really be used for that purpose. So we're hoping that the Janssen vaccine actually will then be a vaccine we can also give to a team that actually visits homes where people can't actually leave home to go to a clinic and are able to make sure that they get vaccinated as well. And again, by being 1 dose, we only have to visit that home 1 time, which also makes it a very good vaccine for this purpose. So that's what we're hoping we'll be able to use that vaccine for once it starts arriving.
And a follow-up, Don?
And the follow-up would just be one about variant cases in terms of identifying them. So, I mean, Niagara has 118 variant cases, I believe, identified right now, but obviously you've only identified 4 as the UK variant. Can you walk me through the process in terms of identifying the actual variants themselves and why it takes so long to actually figure out which is which?
Yeah. So when every person who tests positive for COVID-19, that same lab sample is sent off for the screening test to identify now, is the virus detected there one of the variant viruses? Does it have the mutation signifying it's a variant? And that's what we mean by that variant screen. It's detecting that there is a mutation on one of in the RNA of that virus, indicating that it is a variant. From there, that sample is then sent off for genetic sequencing. And the reason this part is so delayed is just it takes a long time to do sequencing, as well as there's not a lot of capacity to do it. So, in the best case scenario, a sequencing test basically is a 1-week long test. You put in the machine and it basically runs for a full week before you get the result. So it's going to have at least a minimum of that 1-week delay. The province has not planned to do sequencing on hundreds and hundreds of cases of COVID-19. Sequencing was much more a niche technology that was intended for really looking at, if you're looking at a cluster spread, we could do some sequencing to figure out, is it actually the same version of the virus that is spread, to give us some indication of what our patterns of spread. It's supposed to be used in a really targeted way, so there wasn't that mass capacity to do sequencing of every single variant sample. And as the number of variants has increased, it's really overwhelmed the capacity the province has to do that sequencing. And so getting those sequencing results has slowed down. And I would not be surprised if in the coming weeks, we actually stop doing sequencing on all variant cases. It actually becomes more of a random sampling just to get a sense of what's out there, just so that it better matches the capacity that we have, because it's very intensive. It takes a long time, and there's just not the capacity to to sequence every single sample of COVID-19 that tests positive in Ontario.
Okay, thanks, Dawn. Up next, we have Gord Howard. Should be able to unmute now.
Hi, everybody. Dr. Hergy, I've got a question about casinos. They're allowed to reopen now, but at numbers so small that Niagara casinos don't think it would be feasible. It's like 50 people. The Niagara Falls mayor has been advocating that they should be allowed the greater capacity based on floor space. Do you agree, and could it be done safely?
Yeah, this is really a decision the provincial government makes in terms of what could reopen. So I would really leave it to the provincial government to make those decisions. I haven't been involved with seeing all of the different considerations that they would take into account in deciding whether a premise is able to open. So I think that's something I would really want to leave with them and not start to speculate here on what might be the appropriate level of capacity that the casino could hold.
Sorry,
follow-up, Gord?
Yeah, we know of 2 businesses, one in St. Catharines, one in Fort Erie, that are both have both posted signs saying masks are optional. I doubt that you would agree with that. What are your thoughts on that?
Yeah, the province has regulations in place that make it the law that a business welcoming the public or actually even employees onto their premises have to have a requirement for people to wear face coverings. So it sounds to me, not knowing all the details, that those two premises may be operating outside of the law right now.
Thanks, Gord. Up next, we have Richard Harley. Let me find you on the list. There you are. Should be able to unmute now.
Hi there. Hi, everybody. I just one question here with the release the region sent out this morning. It said clinics will rotate around different communities at a frequency that mirrors the size of the 80-year-old population in those communities. But then I see that Niagara-on-the-Lake, which has a pretty high population of seniors, it only has 3 clinics in the next little while on the schedule there. So is it based on total population of those people or percentage of population? If you can just clarify that for me, how that works and why Niagara-on-the-Lake only has 3 clinics coming up.
For sure. So, Niagara-on-the-Lake, of course, has a large proportion of persons who are 80 years of age and older, but its actual absolute population isn't very large because Niagara-on-the-Lake doesn't have as big a population as a place like St. Catharines or Welland or Niagara Falls. And so the number of clinics there is based on how large the 80+ population is in absolute numbers in Niagara-on-the-Lake, and 3 clinics was the appropriate number to hold there. The other detail, of course, is different clinic sites have different capacity of how many people we can vaccinate in them. A larger space allows us to vaccinate more people. And so somewhere like Niagara-on-the-Lake actually has a larger space than Lincoln does or that Waynfleet does. So it's actually, 3 clinics there actually is proportionally much more than some of those other communities would have.
Okay, awesome. And can you give me a sense of how many people you think are going to be able to get their vaccine in a clinic, in a clinic day?
It really will depend on the size of the clinic that we are operating that day. We have clinics as small as 200 in some of our smaller locations, and we are going to have clinics as large as over 1,500 people in some of our larger locations.
Okay, thanks, Richard. And up next, we have Penny. Go ahead, Penny.
Hi, thank you, Meredith, and thank you, Dr. Hergy. Also on the topic of vaccinations and the schedule, I'm wondering for the smaller municipalities that have fewer days to choose from, even though, as you said, Niagara-on-the-Lake has a fairly large space, is there anything to prevent residents from going to one of the other clinics? In other words, if a Niagara-on-the-Lake resident 80 years or older tried to register for a Niagara Falls clinic, are they able to do that, or is there something in the process that directs them only to the Niagara-on-the-Lake clinic?
Residents are actually able to book to any clinic that they would prefer. So if the dates of the clinic closest to them don't work and they're willing to travel to one of the other locations, they're absolutely welcome to do that. The one other thing I would highlight is that I'm hoping that once we get into April, we'll have pharmacies and primary care also able to do vaccinations here in Niagara, creating even more possible locations for individuals in Niagara-on-the-Lake to get their vaccine.
Thank you.
And a follow-up, Penny?
Yes, what I was going to ask, and I can't really imagine that there would be much call for it other than maybe somebody who had a family member in another health unit, but is there also anything in the application process that prevents people from crossing over from the health unit where they live to another area for their vaccination?
So the provinces approach this as an Ontario booking tool. So they are allowing individuals to register for a clinic really anywhere in Ontario, no matter what their health card has as their postal code. I think that is significant because we have actually found through our contract tracing efforts when trying to identify cases that often people have a health card that is in a different municipality or a different part of the province from which they live. People aren't great about updating their health cards. As well, you often have students who may be living in a different area than where their health card is registered in. Many people through the pandemic have chosen to move in with family members in perhaps another part of the province because they haven't needed to commute to work. So the province has allowed individuals to really register anywhere in the province and not be tied down to the postal code of their health card.
Okay, thank you.
Thanks, Penny. Okay, so we've gone through a full round here. I think we have about 10 minutes left. If anyone else has another question, can you just let me know in the chat? And then we'll go back through. Okay, so we will start with Bonnie and then go to Ludwig. So Bonnie, just let me unmute you. There you go.
Thanks, guys. Dr. Hirji, just a personal question. Have you taken any vacation since the start of the pandemic?
I have taken a small amount of vacation since the start of the pandemic, but as you are no doubt implying, it is definitely very busy and there has been proportionally very little vacation compared to past years.
Thanks, Bonnie. Ludwig, down to you. 1 second here. There you go.
Yeah, proportionally less is probably, I can imagine that. Dr. Hirji, this might have been touched on before, apologies if so. Just a quick question. I know you have been studying mobility data and you've been trying to discern what goes through the heads of people who venture across the regions, provinces, etc., and engage in various behaviors that might not be productive to fighting the pandemic. So could you just talk a little bit about what you're seeing in recent weeks in regards to mobility data, observations from the community as how people are congregating, moving, lots of reports of parties and stuff still happening. So could you talk a bit about what we're seeing in terms of that and how it relates to the pandemic?
Yeah, the mobility data we look at allows us to track, really the kinds of categories of places that people might be going. Are they going to parks? Are they going to retail, etc.? We definitely saw around the February long weekend, which was really the point at which the province started to reopen, and we moved into the gray level, which allowed some retail to open to with capacity limits, that there was a pretty sharp increase in individuals starting to once again start to frequent retail establishments and be out and about in the house. We saw a decrease at that same time of people being home and staying within their residence. And really in the last couple of weeks, as we've moved into the red level, we've seen that's actually gradually increased further with even more people being out and about in retail and even fewer people remaining home for most of their time. So, the provincial reopening is having, I think, really what we would probably expect to be the case, where if there are more things for people to do outside of the home, people are more likely to go outside of the home and partake in some of those activities. It is obviously a concern that we are seeing that because we know the more people are in contact with others, there's opportunity for infection to spread. And that is, unfortunately, exactly what we're seeing so far. The one other thing that we are seeing within our mobility data is a substantial number of people from outside of Niagara coming into Niagara in some of the places where we might expect tourists to be. Looking at some of our shopping malls, we are seeing, upwards in some cases of 50% of people coming from outside of Niagara to them. Looking at a place like Clifton Hill, we are seeing the majority of people coming there happen to be non-Niagara residents as well. And that's, of course, a concern, particularly when we think about parts of the GTA that have higher proportion of cases of COVID-19 than we do, that we are at risk that those individuals are going to engage in the kinds of social interactions here that could allow infection to spread amongst our population. I think that's exactly what we saw in November, December, leading to us seeing the third wave, which probably originated more from the central part of the GTA and spread here. And we're at risk of seeing that happen again, which goes back to my earlier comment to Bonnie, which is, if we are to do something to reduce cases, I really think the province has to approach the entire Golden Horseshoe as one big unit.
Thanks, Ludwig. And I believe Gord has one more question too.
I wonder how many more retirement homes you've got to get to, or if you got to them all so far. I asked because the Hamilton Spectator had a story today that there's some question as to whether unlicensed homes would get a visit.
Yeah,
for
so
vaccinations?
we have visited every long-term care home for 2 visits to get both shots of vaccine delivered. The province designated 14 of our retirement homes as high-risk retirement homes, and we've as well done 2 visits to those to give them 2 doses of vaccine. The remaining 20 licensed retirement homes, we have now actually visited all of them and delivered 1 dose of vaccine to them. And we've visited as well several other unlicensed congregate care settings where there's large numbers of seniors to deliver a dose of vaccine to them. And there's a few more that'll be done the balance of this week. With some of the unlicensed premises, what we had to do is that actually if you start looking at every unlicensed premise, there's an overwhelming number there. And given we need to pivot to start doing vaccinations of the larger population, we couldn't actually visit all of them. So we've tried to zero in on is the unlicensed locations where we've seen outbreaks, make sure we go in to vaccinate them, as well as unlicensed locations that have relatively frailer individuals who would have trouble actually traveling to one of our clinics to get vaccinated and going in to vaccinate them. Other senior residences where there's people who are proportionally maybe not as old as 80 years of age, they're generally more healthy, more able to get out and about, more likely to have access to a car to travel to a clinic. We really aren't going to be going into those settings and expecting them that they will find a way to book a visit to one of our clinics to get vaccinated instead.
Okay, thanks everyone. I think that's it for today. If you do think of any follow-up questions, please email Courtney or me or Carrie Stokely and we'll get back to you as soon as we can. And we hope to see you all next week. Thank you.